right. Hello, everyone. Welcome back to the Rise to Your Peak podcast. I am back here with my guest today, Lauren Valentino. As you all know, she's been on the podcast before, and we had a banger episode, and we're coming out with another banger episode today for you guys. Today, our topic is why our healthcare system is the problem. And this is a loaded conversation with a lot of details, so buckle up because this is going to be a good one. Lauren, how are you doing today?
I'm doing awesome. Thanks so much for having me back. I love connecting with you with all of, all of our business topics. And then
Yeah,
also, we get the opportunity often to work together to help clients understand why they are unwell and help them heal. And
yeah,
I'm excited about today's topic because this is something that you and I run into frequently with
unfortunately.
patients, yeah, patients who have, gone the typical path of what we understand is the, right way to do things in the
Yeah,
United States, reaching out to our medical professionals and then just, we normally sadly get the patient once they have exhausted all efforts with what the medical system can offer and provide them, and yet they're still sick.
yeah,
And so, it's so interesting it's sad the amount of time, energy, and effort people waste
yeah,
when they don't understand really how to ask the right questions centered around their health and how to vet their, healthcare practitioner.
yeah,
And then, sadly, our system is really set up to focus on treating the or providing options for the symptom. And that's where, you and I have the opportunity to really help patients on a deeper level.
yeah,
So, I would love to hear from you because what one of the pieces that you and I talk about and broach with our clientele frequently is insurance. Insurance and people really wanting to get the most out of the
yeah.
insurance that they're paying for. And then, I would love to hear your thoughts on that. Is that the best path? Is that, something that you would suggest someone do? Talk to me about, what you see in your practice and just the mindset centered around it.
Yeah, so I mean, like you said, the first thing people kind of need to wrap their heads around is the different approaches to healthcare. And in our society, we have a very symptom management approach versus a root cause resolution approach. And those are two very, very different discussions.
Sure.
And and so that's kind of like the base layer that you need to understand is like your expectation of what they're going to do is probably wrong. Um, which then leads into the entire healthcare model and how it relates to insurance. And you know, I would say we could both agree that, especially in the past 5.5 years, there has been a big shift in terms of like trusting your provider and blindly trusting the healthcare system, the CDC and NIH and stuff like that. So people have definitely learned since COVID that they need to be their own bigger health advocate and kind of explore different approaches or different thought processes on why they may be having the symptoms they're having. However, there is still this general thought process around, trust your doctor. They know best. They have my best intentions in mind. And similarly with that is this concept in America of, for lack of a better word, this God-given right to health care via insurance. And it's not God-given right, we're paying for it. And so that puts an even bigger layer of like, not only do I feel like this is my right, but I'm paying a lot for it.
Hmm.
And so there's this expectation that everything should get covered through insurance and that I'm getting what I pay for. What people need to understand is that insurance is a business, and their job is actually to do everything humanly possible to not spend money on you.
Yeah,
It-
I actually want you to back up and say that again.
sure.
Insurance is a business.
Yeah.
And I really believe that, that is a concept that people need to sit with for a
Yeah.
minute. We think when it is centric to our health because health and healing is something, so personal, so emotional. So, you would think that there's this compassion piece to, you're unwell,
Yeah.
you are going to practitioners to help you get well. It is so important to just in protecting yourself to back up and realize that this is a business.
Yeah. Yeah. I mean, we, whether we're talking health insurance, car insurance, home insurance, there's always an adjuster. And so let's think about this. The adjuster's role is to literally do everything possible to find ways to not pay for things,
Hmm.
not cover your car accident, not cover your medications or your health services. That's their job. Find ways around coverage or try to find excuses or determinations as to why we wouldn't cover this for someone.
Sure.
So the general idea is not, it shouldn't be that my health insurance is going to take care of me. Quite opposite. Health insurance is doing everything possible to take your money and not take care of you.
Hmm.
That's the business model. Um, so with that, they make it extremely difficult to get proper care because proper care is expensive. Um, and so, you know, they, in many ways, one example of why it's so difficult to get proper care is the way they approach prescriptions. Prescribing medications to someone is not based necessarily on their symptoms, not based on the most effective drug for what they have present. It's based on a cookie cutter approach of first form of treatment versus secondary or third forms of treatment. And so the primary treatment option is not based on effectiveness, it's based on cost.
Mm.
And so if you know that this one drug is going to be the most effective for you, they're still going to make you take other drugs prior to that
You mean
before they
you mean
determine
cost,
it's
not just
worth
cost,
covering.
but cost and kickbacks.
Right. Exactly. And that's another piece, the insurance companies are working with big pharma. So everyone is benefiting from you not getting better. Because if they treat the symptom, big pharma makes money, insurance saves money, and you're going to keep paying for that insurance. And now you're most likely going to end up with more symptoms, whether that's from the treatment or from the root cause that never got addressed. And big pharma is now guaranteed long-term money.
Mm.
So big pharma and insurance companies are working together in conglomeration to create long-term disease and long-term
Customers.
dysregulated health to ensure they have long-term customers.
Hmm. Hmm. Yeah, when I start with a new client, I always like to kind of pause up front, ask them if they've worked with a functional health practitioner before, and really just explain the difference.
Yeah,
I do feel like in functional health, I think we all have a space.
yeah,
I'm a bit sunshine and rainbows, like to believe the best of everyone. And I just like to kind of pause and be like, listen, if I break my arm today or if my appendix ruptures, I'm going straight to the hospital and I'm
sure,
going to be very happy to, use my insurance.
sure.
If I am concerned about some GI dysfunction, about, some, autoimmune symptoms or something like that, I actually want to not just look at my symptoms with someone. I want to find out why do I have those symptoms?
Yeah,
And, when you and I have collab calls with clients and we start doing this, what we call our breadcrumb trail of asking questions that these people have never been asked before. You
Yeah.
know, if you remember back, not that long ago, we had a girl that we were working with, who's been unwell for a while, and she goes, we asked her the question, "Hey, when did this start?" And she goes, "I know this is the weirdest thing and it doesn't matter at all, but it's when I came in contact with this homeless dog." She described this day because she remembers it. She thinks that this piece of information is completely invalid
Yeah.
for coming in contact, with this animal that
Yeah.
actually ended up making her sick. When we ran, a toxicity test on her, we started uncovering all of the data that she's like, I know that none of this matters. But
Right.
we were able to, and we paused her and we were like, actually, that matters so much
Matters a lot.
in why you are unwell right now. And
Yeah.
so it's really important to, understand if my AC is broken, I'm not calling my mechanic.
Right.
I mean, it's really important to understand showing up at the right place
Mhm.
based on what your personal goals are.
Yeah.
We do have some people, and to each their own, and everybody is going to have their path at different chapters of their life. If you just want to treat your symptoms, okay, great.
Right.
If you're a human being that doesn't want to work out, doesn't want to eat healthy, doesn't want to be well, wants to live a sedentary lifestyle, wants to, be American average,
Right.
okay, cool. Please go
Yeah.
to your MD and, get, because there are people who, have a genetic predisposition with, family stuff of, high blood pressure or this and that, and they're not going to change their lifestyle.
Yeah.
Great. The tools that our MDs are given will probably extend their life a few years longer.
Sure.
So I
Yeah.
think it's really important to, understand the person's goals,
Yep.
really help them find what is the best fit for them. The
Yep.
people that you and I come across don't are not, they're not lazy people. They want to be well. They want to, be able to lift their grandkids, be that cool, person that's able to keep up and live this vibrant life into, old age and
Yeah.
be around, with great cognitive function, with great, strength and wellness. And that's why they're so frustrated when they
Sure.
come to us after they've exhausted efforts, trying to make their insurance work for them since they're paying this, premium.
Yeah.
And they have done all these things and they're in the same place, if not worse.
Exactly. And I mean, to go back a little bit to your point, it's very important that people recognize this. Like you said, in terms of acute emergency care, we're the best in the world. We have some of the best heart surgeons, brain surgeons. So, like you said, if we got in an accident right now, we would both be like, yeah, let's go to the hospital. In terms of chronic disease, we are the worst in the world. Third world countries with AIDS are doing better than us in
Yep.
terms of chronic disease, yet we spend 3 times more than any other country on healthcare.
Sure.
So this is what people need to really recognize is that there is an epidemic, but we're paying attention to the wrong things. It's
Sure.
not red dyes and gluten that's truly the epidemic. It's our healthcare system's deficiencies that is at the root of our epidemic. And I think it's, I even got ahead of myself a little earlier. I think we need to really unpack this through a timeline that people can understand. So, first and foremost, let's talk about a physician's education because I think there's this expectation of how a physician should treat you and listen to you and this and that. But we're going off of this idea that these are brilliant minds that have all this in-depth education to help and stuff like that. And that's not necessarily the case. So, first and foremost, the med school curriculum is written and influenced by Big Pharma, which means they control what our physicians are taught.
Yep.
And when we look at that curriculum, there is no discussion around nutrition, there is little to no discussion around sleep, recovery, and lifestyle, and all of these impacts on how our body functions. Most of the emphasis is put on pharmacology, which
Yep.
is treating your symptom.
Well, and let me pause you there and play devil's advocate. You know, you know the time that you and I spend with a patient.
Mhm.
Is this set up not just from the perspective, like you said, of big pharma, of insurance, but also for their ability to spend 15 minutes with a person?
So I'm gonna get to that. Let's unpack this to its full extent so
Sure.
people
Okay.
truly
Sorry. Jump ahead.
understand. So they go into a school curriculum that's actually set up for failure to not help people. They're convinced that it's good to get a half a million, if not a whole $1 million in financial debt to accomplish this education, which also takes over 10 years. So they've dedicated over a decade of their life and almost $1 million of debt to this limited education. And then as soon as they get out of school, they're exhausted, they're way overworked, but they're finally at a place where their life has come true and they can be a doctor and they can start helping people. So they're so excited about becoming an intern in an ER scenario. But then what they don't realize is their pay is actually based on how many patients they see per day and how many prescriptions they write per day. Meaning they are incentivized to see lots of patients every day and prescribe lots of medications per day. They're actually paid more based off of that.
Mm,
So when you take that aspect and bringing up your point of the average PCP in a busy hospital setting is seeing 100 to 200 patients every single day.
mm,
They're typically seeing 30 patients before 8 a.m.
mm.
So really try to wrap your head around a 12-hour day, 200 personalities, 200 different health detriments, and all that's trying to unpack in this little 10-minute, 15-minute window of information before they move on to the next person.
Sure.
There
Sure.
is no discussion around their life, their diet, their day-to-day choices. All there is a discussion of their current symptom. And there's no discussion of other symptoms.
Mhm.
How does that human know that that current symptom connects to a nervous system symptom, which then connects to a GI system symptom? They don't know that. They're hoping the doctor will say that.
Mhm.
But the doctor never learned those things. And the doctor is not incentivized to use deductive reasoning. In fact, the doctor is incentivized to put his head down, look at his note cards from pharmacology class, and say, this woman has acne. I'm going to prescribe her metformin for PCOS. It's a very cookie cutter symptom pharmacology approach and send this person out of my office because I have 99 more to see before lunchtime. And an unfortunate process that happens every single day in our healthcare community. And what we have to understand is because of that full timeline, because of the debt, because of the exhaustion, because of how hammered they're getting every day, there is zero incentive to continue their education or further their knowledge base or to use deductive reasoning. Do you really think any physician is going home thinking about their 8 a.m. patient and being like, man, I wonder if we really got to the root of that?
Valid point.
There, you're an afterthought. If that, you are never even a forward thought, let alone an afterthought. And I want to go through this because a lot of the times we're demonizing the practitioners. But as we understand this timeline, the practitioners are victims too. They went into school thinking that they were going to do good deeds and help people and resolve disease. But it was only in the midst of that chaos that they realized, like, I just need to put my head down and work because I'm $1 million in debt and
Mhm.
I'm exhausted. I have GI issues. I have hormone imbalances and metabolic disease. When was the last time we walked into a hospital and everyone looked healthy? Never. Never.
That was a point that I was going to bring up.
Yeah. Let's think about hospital cafeteria food. What the fuck?
So I actually want to backtrack you just a touch. You talked about, how much and I do love that I get to work with some really great MDs in collaboration and those people that I choose to bring into my workspace obviously are different than most because they are very honest. I
Yeah.
mean, I have an OBGYN that's like, I'll tell you that we spent about zero time on female hormones.
Yeah.
But women who have hormonal issues think, well, if this is a sex hormone dysfunction, I should go to my OB.
That's the specialty.
And yeah, and so I have a pocket of MD friends that will be very honest and be like, we got maybe a week of this. So I want to backtrack, and I don't want to spend too much time here because you and
Yeah.
I could do another hour here. Um, you mentioned the nutrition aspect.
Yeah.
You mentioned lifestyle. I think it's so important to pause there because, of course, people watching this will be like, oh, functional MDs, yeah, they talk about nutrition and exercise movement. So I want to actually, because, people are always looking for that edge, that shortcut, that fix me fast. And it's so important to kind of pause and be like, hey, I want to remind you that we're human beings.
Yeah.
Our bodies are not robotic.
Yeah.
And in 2025, we expect to, just like our cell phones, we plug them in at night. We should wake up in the morning. They should be full of battery and like at our fast function all day long.
Yeah.
We are humans. We are permeable beings with, mind, body, spirit, the interconnection. We are sponges
Yeah.
to our environment. You don't you don't skip a step. Matt, I know you're into, cars and fast cars and all the cool stuff. Would you put unleaded gas in your, high performance vehicle and
Never.
expect it to function and expect your engine to do, all the cool things
Right.
that you have designed for it to do?
Right.
So, we kind of snarl at the nutrition piece, but when you really understand every single endocrine function and the inner workings of, our central nervous system, our brains, our body, all of it requires
Mhm.
the fuel.
Yeah.
And even just taking like the thyroid, for example, hey, if you don't have enough selenium or iodine, if you don't put the right ingredients in to bake the cake, if you forget flour, do you expect to pull it out perfect?
That's right.
So, kind of rolling back and you just saying nutrition, for people watching this, it sounds like, oh, okay, whatever, food, right?
Right.
Understanding how much food impacts function is is vital. I mean, to really expecting high quality anything out
Yeah.
of your body. And
I think a lot of that comes from the complexity of a human being. Because, like, we can say a plant needs sun and water, and everyone's just like, oh, yeah, duh. Like, no one's surprised when their plant dies because they're like, yeah, fuck, I didn't give it water. But, like, with our bodies, when we talk about nutrients, and I think a lot of it is the emotional attachment to food. So we talk about nutrition and everyone's just like, oh, fast food or whatever. We're talking about nutrients. We're talking about the fuel for your mitochondria and for your organs to work properly. Your brain, your heart, your lungs, your kidneys, your thyroid, your pituitary, everything is relying on resources to function properly. It's just like a house that's getting built requires lots of resources to be built properly.
yeah,
And no one's really understanding what we mean when we're talking about deficiencies or poor choices. It's not that we're being zealots around ultra processed foods. It's that we're recognizing the deficiencies and the lack of benefit from that versus a whole food product. And then when we also take into account that, excuse me, the food industries are directly lying to us and telling us opposite effects, that eggs and meat are bad. The things that have been around for thousands of years that humans have eaten are bad. But what's good is an ultra processed vegan fake bar. That's good, made of
Sure.
insects, but beef is what's really bad for us, you know?
Yeah, I like to remind my clients just because you can chew it and swallow it doesn't mean it's food.
Well, and I think, to go back even one layer from a business aspect, you and I and anyone listening who's an entrepreneur or big into business and marketing will understand this. The two primary focuses of every successful business in the modern day, what are we selling? Speed and convenience.
Sure.
Those are the two sales points of most successful businesses in the modern day. If you can do it faster and more convenient than your competitor, you win.
Yep.
Let's think about pharmaceutical advertising. Everything we're taught is speed and convenience.
Sure.
Adderall, Ozempic, Xanax. So we're put in this place of constantly like, we expect immediate results because that's what we've been sold or marketed for 30, 40 years is speed and convenience.
Sure.
Nobody wants to change their lifestyle, change their diet, and discontinue all those bad habits. That's very inconvenient,
Mm. Fair point.
you know? And so I think we all need to recognize that we're kind of victims of a sales scheme. This is a sales scheme that we've all been part of for a long time, and it's working magically on all of us. And we all have improper expectations. And going back to the demonizing of practitioners, another area where almost everyone complains about their physician is the ability to run labs. But what they're not understanding is the practitioners
Can't
are
read them.
handcuffed by insurance. Insurance is deciding not to run your labs, not the doctor. The doctor will get in trouble for running ultra comprehensive labs that cost $500 because
Mhm.
the insurance is paying for it.
Mhm.
So again, your expectation of proper health care is actually hindered due to your expectation that insurance should be paying for the proper health care. If you want proper health care, you're not going to get insurance to cover it. And that's the exact difference that we often see in a lot of functional medicine practices, Ryze particularly, but most of the time they're avoiding that blockade or red tape that insurance provides, and they're actually able to use deductive reasoning, common sense, and get to the root cause and skip ahead to the real resolution that's been hiding in the background.
Mhm. Mhm. I am listening to you and I think back to my early 20s. So when I was really busy and competing, and I went to just, annual OB
Yeah.
checkup, just on the books, right? And on both sides of my family, I have a thyroid history. And so I said to her, I was like, hey, when you do my labs today, can we check my thyroid? And she was like, are you feeling any thyroid symptoms? I was like, no, but I want to be proactive because I have a family history on both sides. And she looked at me and she goes, so you're really tired. I was like, oh, yes, exhausted. And she's like, and your hair's falling out? I was like, absolutely. So she walked me through a few things that she needed to hear to be
Mhm.
able to code this to run my labs.
Yeah.
And I was like, it was just such a moment for me where I was like, wow.
Yeah.
I mean, you can't take that I have a genetic predisposition on both sides and that's
Right.
enough. Like, she had to, cover herself on being able to actually code and get done what she was willing to do for me, but unwilling to, or, but unable to do.
Exactly. Yeah, I mean, you and I run into it a lot in a lot of the recent cases with insurance looking for prior authorizations. And this is a conversation that RFK has had openly, basically admitting that he can even see that this is kind of a corrupt situation of prior authorizations where their insurance companies are just intentionally avoiding covering people through intentionally creating all these hoops to jump through that the provider is then bogged down, and it's all these just ways to avoid or just delaying it 6 months and giving no response of whether or not they're going to cover something. But even though through this experience of seeing prior authorization paperwork and what our PA and MD have to complete for people, one, it's very vigorous. Sometimes it's 5 pages long. And most of the questions they ask are very similar to what I brought up above. So let's use rifaximin as a great example, because rifaximin is very popular for SIBO and bacterial overgrowth in the gut,
Sure,
but it's insanely expensive, and there's no other medication on the planet shown to have a similar efficiency.
sure.
So it's one and only, and they know that. And so, typically without coverage, what we generally see paying out of pocket, it's around $2,000.
Hmm.
And so, of course, insurance doesn't want to cover that. And so they're always requiring prior authorizations.
Hmm.
In that prior authorization document, they ask, did this patient get diagnosed with traveler's diarrhea? Did this patient attempt this medication first, this medication first? And there's this list of prerequisites basically before they will qualify someone to get covered for rifaximin. Rifaximin is an antibiotic. Antibiotics treat bacterial infections, not traveler's diarrhea. So right away, we have to see this red flag and say, we're quoting symptoms, not the root cause. We're justifying an antibiotic for traveler's diarrhea, not for infections. That basically ends any discussion around proper healthcare or educational, approaches.
Sure,
And then for
absolutely.
them to say, well, try this medication first, the medication that is proven to have zero efficiency against SIBO. You
Mhm.
want us to try that first. An anti-parasite medication you want us to use for bacteria.
The amount of those conversations that we have are so concerning because Matt, I mean, you and I both are, I'm sure, cringing on the inside of how frequently we see that feedback
Yeah,
between clients and their MD.
yeah,
I mean, and the thing that even, I know there's a lot that I don't know. I'll be the first to tell you if I don't know something, I'm not going to pretend that I do. But
sure.
you would think that as an MD having a discussion with someone about medications, I mean, it takes you 2 seconds to look that up. I mean, like the things that get relayed back to us, we just go, what? And it's and then we have to prompt our patient to fact check what they were told on, both sides. And they're just like, what?
Yeah,
We see that often, and it's scary.
yeah,
The other one that, I'm seeing more and more is, in talking about insurance, we have, patients that come to us, and you and I are not gatekeepers. We want people
sure.
to be able to, afford the things that they can to get themselves well.
Yeah,
And so, I'll share the list of labs, comprehensive labs that we like to do to kind of get started with someone. And it's wild how many of my people come back to me if they can get their MD to run them, and their MD says to them, well, I don't know how to read these.
yeah,
And hey, I appreciate honesty.
yeah,
Like, I appreciate the honesty. But the one that I see so frequently, and I'm sure you do too in your practice, is centered around thyroid health.
yeah,
I mean, the amount of time that people have hardcore thyroid symptoms and they go to their doctor to get labs done and they just run TSH.
yeah. And that's a problematic topic in itself, because when you really learn about the thyroid prescription process, you understand that their approach to testing is based on their approach to medicine, not vice versa. So, with Synthroid being the most commonly prescribed thyroid medication, the justification for Synthroid is a TSH marker. So that's what they're basing it on. In order for me to prescribe Synthroid, I have to run TSH. There's never a consideration of, let me see how the patient's full thyroid is doing. It's just, in order for me to prescribe this, I have to run TSH. So that's what I'm going to run.
Mhm.
They don't understand how the thyroid works. They don't understand the difference between production and conversion and the different pathways. They're just trying to go by the book, and the book says run TSH. And if it's skewed, prescribe Synthroid. And so it's again, it's this cookie cutter, no deductive reasoning, minimal common sense utilized. And we're not actually working to resolve the patient's issue. We're working to prescribe. That is the goal.
Sure.
Patient comes in, I'm going to prescribe. I can't let this person go out the door with nothing. That's kind of the idea. Something is better than nothing. But that's but a thyroid medication is not technically better than nothing, especially if it's not the solution, you know?
Sure. Yeah, and and just kind of talking about things, with our healthcare system being a business. And, I do have people that have conversations with me about, I mean, just being responsible about finances. Hey, so if I go this route with you, what does that look like? And, the thing that's always interesting to me is that if you're working with someone in functional health, and I'll just speak for, my ethics and your ethics, which I know, we both have wait lists.
Yeah,
And it's so important to me. I like to tell my clients up front, I don't want to work with you forever. Like if
yeah,
you need a babysitter, I once we get you well, I
yeah,
will, happily hand you off to someone else. I love accountability. I am
yeah,
not trashing accountability at all. I think it's so important. It's actually a piece that my entire business, Wholly Fueled, was developed around is accountability and
yeah,
community.
yeah,
Um, but if you're working with a functional practitioner who is good at what they do, they have so much word of mouth referral because when you get people better, they're going to tell everyone that they
yeah,
know. And, it's really important for us being compassionate about what someone is going through is to figure out their optimal approach, get them better, and pat them on their tush and send them on their way.
100%.
And,
I
it's
tell people all the time if as a functional profession provider, if you still have clients after 12 months, you've missed the boat.
you have absolutely missed the boat.
Now, granted, there maybe are some extreme cases that do take longer than 12 months. But in 12 months, you should have found a lot of root cause. You should have helped this person do a ton of internal work, whether that's mental, physical, physiological. There should have been huge progress. That should be a new person in 12
Sure,
months.
sure. You
And to
know,
your point, accountability is not really what we're offering. We're offering reversing chronic disease. Lifestyle coaching is more so where the accountability equation comes in. And I kind of do the same exact thing as you. Once you're healthy, great. I have some great people who can keep you healthy, keep you accountable, and discuss with you these secondary goals of a little bit of fat loss, a little bit of muscle growth. That's just not where my forte at this point in time in life. I
sure,
have 100 people waiting to fix their disease like you know.
sure, sure. And I want to pause at that piece. We always tell our clients up front, especially with GI healing, like mycotoxin, Lyme, autoimmune, the main reasons that hormone balancing, the main
Yeah,
reasons that people come to us, we're real clear on the front end that hey, this is not a body recomposition plan.
right.
Matt, I want you to find me one of your clients out of, I mean, I have hundreds, maybe thousands at this
Yeah.
point. I've done that high level work with. Find me one that we have not done a complete body recomp on by healing their internal dysfunction.
No,
I don't have one. I
no.
just got off before meeting with you. I just got off with a woman. We've been working together for 4.5 months. She's 28 pounds down and eating more than she's ever eaten in her life
Yeah,
from healing internal dysfunction. All of the secondary things that you just mentioned, it's wild how, even though that's not our focus on the front end, when you help the body be calm, when you support the nervous system, when you eradicate these, dysfunctions and overgrowths, and you help the body just be able to do what it knows how to do by itself, which
right,
is to function and to be well. When you
right.
support those things, everything else falls into
That's
place.
right. Yeah,
So,
a healthy body is a responsive body,
yes,
and almost anyone is going to see progress in their mental health, physical health, and aesthetics by getting healthier. Um, and that's where, the people who are very emotionally tied to their GLP-1 peptides and things like that, I'm really glad that it's helped you, but there's a reason that as soon as you discontinue, you gain that weight back. And it's because you're band-aiding the disease and dysfunction that's in the background. And
yeah,
although you did successfully lose weight, you didn't reduce your cardiovascular disease risk. You didn't change your endocrine dysregulation or your mental health dysregulation. You didn't reduce your chances of peptic or colon cancer or the toxic burden that's plaguing you. That's why the weight comes right back. It's because the dysfunction and inflammation is still present. You've just been successfully band-aiding it temporarily. And that's what really needs to, be discussed more because I'm not against GLP-1s. You're not against GLP-1s. We actually have patients who have completed a healing treatment and still wanted to just leverage something to speed up that weight loss process once they got healthy.
sure.
And there's a difference between leveraging a tool in your toolbox and relying on something to give you results.
Well, when you start with a GLP-1 without addressing, the reason that there's a problem, you create addicts.
Yeah,
I mean, and that's what we see often and frequently. And the sad part of that is that unless someone is really working with someone to understand the importance more than ever of strength training, of
yeah,
eating enough protein,
yeah,
of really managing their nutrition on a
yeah,
GLP-1, you actually have that person end up with more neurological dysfunction because of the changes of how, they're approaching food now.
yeah,
You actually have them end up with more skeletal muscle issues.
yeah.
And those are harder to fix because if you get off of the GLP-1, you're still a broken system. And actually, you're now a really malnourished, broken system.
Well, and that's the thing. The GLP-1 isn't causing muscle wasting, isn't causing blindness, isn't causing the other detriments that they're currently talking about. All of those are coming from the poor lifestyle choices, the lack of exercise, the lack of eating because of the GLP-1.
Right, right.
So it's not the GLP-1's fault. It's kind of your fault for remaining sedentary and not choosing healthier dietary choices and whatnot that work for your body.
Well, stick a pin in that. Your fault because you're not choosing that. But I have so many people that come to me with a GLP-1 prescribed by their physician where they were not told to
Sure.
change their nutrition and
Yeah.
to exercise and to really watch these parts and pieces that are now more important because of using the GLP-1. So, yes,
It's,
I
it's
agree with
quite a vicious cycle, isn't it? That if you just did those things in the first place, you might not even need the GLP-1, but you definitely need to do those things on the GLP-1.
her. Yes. Yes. So, yes, I like that you circled back and talked about that and, really talked about the reason that that is the problem. You're right. It's not the GLP-1, but the GLP-1 changes the way that you want and crave food, which now creates more of a reason for you to do the healthy lifestyle things that were probably told to you in the first place.
Exactly, yeah. And there's this idea that if I take the GLP-1, I don't have to exercise. Remember, speed and convenience. That's the idea. But the muscle wasting and bone wasting is from the lack of exercise, not from the GLP-1.
Right.
So it all comes back to there is no convenient, easy way. You just have to do the work. There's no convenient, easy way to become a millionaire. You just have to fucking work, you
Yep.
know? Like, unfortunately, that's at the end of the day, that's what everyone's discovering slowly and surely. And I don't want to get too far off topic because I know we plan a myth busting episode in the near future too, where we can definitely dive into some of these topics more.
Sure.
But I do want to go back to our discussion around blood work
Hmm.
because that's another good topic in terms of that med school curriculum and what they're really taught. To my knowledge, they are never presented comprehensive blood work top to bottom and said interpret. More so, what they're presented is in different times of their education. These are cholesterol markers, these are liver markers, these are kidney markers, but it's never actually presented in a true lab format to where they could actually go through and discern connecting the dots of cholesterol issues to cardiovascular issues to cortisol, and then the thyroid issues also relating to cortisol. They never learned how a bodily system actually works and how that connects to labs. And that's why so many times we see this over prioritization of conventional reference ranges. And when we see the doctor looking at labs, sometimes we can kind of see they're just looking for green and red. They're not even interpreting levels. They're just like green or red, you're good.
Yep.
They
Yeah,
don't know how to read it.
sure. I mean, I'm dealing with this. I just dealt with this yesterday with a patient who he's gotten into a position of having high blood pressure. And so, she ran labs on him. And I'm looking at the labs, and this is a person who deals with blood sugar issues. So he has blood sugar issues. He has his EGFR, his kidney function
Yep.
is extremely decreased. So we have, kidney issues, and now we have a blood pressure issue. She has now put him on, so she put him on two blood pressure meds that did not work. And now she's put him on the third one, which we've seen a small improvement with, but she kept him on the first two that didn't work.
Yeah.
And I was like, hey, has she talked to you about the connection between your kidney dysfunction and your heart rate and blood pressure?
Yeah.
And he's like, no, not at all. What should I ask her?
Yep.
So we're going through the connection between blood sugar
Yep.
and how the kidneys work and the interplay with our heart. And I'm
Yeah.
like, this is, I mean,
There's no conversation of interconnecting systems. And, we've actually spoken on this before. Our entire medical system is broken up into 100 silos of different specialists. And to the untrained eye, that probably makes us look like this super efficient healthcare system that specializes in all these different categories. And that's the absolute best approach because I know I'm going to a true specialist for these details. But it's kind of the opposite. They've just been, instead of specializing, they've been restricted in their education to a single thought process. That's not a specialty, that's a restriction into a single thought process and they're not able to see the full picture. So then we wonder, why does a patient, your average 50-year-old patient, why are they on cholesterol medication, blood pressure medication, an SSRI, a PPI, proton pump inhibitor for their GI system, and Linzess, which is a constipation drug? You know, all of these things are interworking, but because you went to five different specialists who don't communicate with each other and don't correlate anything, no one's recognizing that there is clearly a stress dysregulation response happening, causing the GI issues, the blood pressure issues, and the cholesterol issues. There's most likely some sort of infection that hasn't been found, you know.
sure.
And so that leaves that person never getting their issues resolved, now taking five different medications, not getting any better.
Well, and back to the case that I just mentioned, when I hopped on this call, I was like, hey, if we've added this medication and it's working a bit, why is she keeping you on the other two that you know, we have checked in on with zero change? Why? And this is a man who is a brilliant, extremely successful human being,
Yeah,
extremely successful. But we get into these places, even as adults, where he's like, gosh, I didn't think about that. He's like, but you're right. We did these two singly. They did nothing. Why am I still on them?
right.
And it's important. I don't overstep where, I don't play in sandboxes I have no business in. I'm not a cardiologist.
Yeah,
Um, I'm not a nephrologist. I'm not, and I will not pretend to be, but I know when to refer to one, and I know how the body works in synergy together, and I know, when to look at this and go, hey, these are things we can handle. But yeah, it is wild. I agree with you. I do not know the answer to your assumption slash question of, are they ever handed a person's top to bottom lab work and asked to interpret this in the sense of, hey, how can you make this person healthier?
yeah.
My suspicion is that they weren't. Whereas I know for you and I doing, functional diagnostic training, that's all we did.
Well, of
It,
course,
you know,
because the purpose of our training was to get people healthy.
sure.
That's not the purpose of their training. And that's why it was so important that everyone hear that full timeline. And this may sound like a very negative portray of our healthcare system, a very Machiavellian view of our healthcare system. But I mean, the writing's on the wall. We're all frustrated and confused as to why, and you guys might not like the answers, but these are the answers. These are factual things. Anyone can check and see what we're talking about and find out that this is real. These are factual things.
It is. And, for me, doing this for, coming up on 17, 18 years and losing count at this point, is that, I have the ability to really speak about a collection of data.
Yeah,
I get lab work nonstop. I get, high level testing nonstop. I'm looking at, okay, I mean, I can speak to this.
yeah,
And, I can even speak to, different methodologies of HRT and how things work and interplay because I am constantly making sure that someone is optimal.
yeah.
And so, I just don't know how much, and again, this conversation is more just to have people use their brains and think and be advocates for their health and make the best decisions based on what their personal goals are.
Yeah.
And really understanding, like I mentioned in the beginning, hey, if you're someone who refuses to make any changes in your life and you want to swallow a pill to quiet a symptom, knowing that, you're going to, any of these things are shortcuts. You're going to pay for them somewhere, whether that's with another prescription down the road or whatnot. But I have no hate towards that. To each their own.
Yeah, I mean, you don't see us protesting outside of hospitals saying, "Don't go in, come to us instead, trust
Right.
us." Like you
But
said, our
what
books are filled. Like we don't have time to try to poach people from Western medicine.
Right. But
Um,
what my goal here and yours is today is really to have people think about where they are showing up, expecting to get better.
yeah,
So, if you're wanting this approach, this is where you go. If you're really confused and frustrated on why someone hasn't figured out why you're having the symptoms, then, your HVAC is broken and you called your car mechanic. I mean, that is what is happening here. And so, we have so many people that come to us after years of work
yeah,
with, practitioners, and they are still unwell.
yeah,
And the amount of people that we walk through a process and at the end of it, with tears with both myself, with you, if they're also working with you, is they just are like, I'm so grateful I'm here. Thank you so much for giving me my life back, getting me off of these meds. But I wish I would have known this sooner. I
yeah,
wish someone would have told, I wish I would have found you guys sooner. Or I wish I would have known where to actually get answers to my problems.
Yeah.
And so I think, for all of us, we are responsible for our bodies, our health, our wellness,
Yeah.
and you have to be an advocate for your health
Yeah.
and just making sure that, you're showing up in the right places, asking the right questions,
Yeah.
and not being afraid to, even if you're being pushed or dismissed out the door because your 15 minutes is up, being able to ask the right questions and really trusting your gut on, is my healthcare leader helping me?
Right.
Are they showing up in the right places? Are they, gaslighting my symptoms? Are they, really hearing me? And do I feel like I am moving the needle forward to getting things resolved?
Right. And to be clear, when we say, hearing me, some people expect a doctor to just do what they say, like, "Hey, I'm having a sinus infection. Will you just write me a script or something? I have a stomach bug. Will you just write me a script?" That's not hearing you.
Right,
That's doing what you said. So
right.
we need to differentiate that. If you come to me with symptoms and I've spent an hour talking about your life and when these symptoms happened and possible root causes and finding that breadcrumb trail, like we say, that's hearing you. But if walking out getting what you desired isn't the same thing necessarily. So I just want to give people that proper perspective. But yeah, I think a great analogy is we all pay for public school through taxes, but certain parents still decide to invest the money in private school. That's because they know the value of that extra money towards their children's education and care. Why aren't we putting that same value on our own healthcare in the next 30 years of our life? I understand we all desire it to be done, optimally, but that's not the system we're in. I'll be honest with you, and I haven't had health insurance in probably 4 years. Now, granted, I have some doctors in my back pocket, so I'm in a really different position than most people, but we deal with this all the time with people. You've had chronic disease for 20 years. You're spending 400 a month on health insurance. That's what, 5 grand a year. So for 20 years, you've spent 100 grand on healthcare and you still have chronic disease, but you're mad that you have to spend $250 on blood work to actually show you the chronic disease. Let's be realistic
When
here.
you pause and do the math, it's like, well, that's stupid. I
Yeah,
mean,
and I'm not saying cancel your health care today. I'm just
yeah,
saying perspective is everything.
sure.
Don't be mad at us because of, the value of the services we're doing. We're avoiding insurance so that we can give you that high value, high quality service. And so it's just a matter of an expectation change. But I know, we're running low on time. We wanted to hum a few lines about like red flags, green flags of like feeling confident in choosing a provider. Is there anything you want to share specifically in that regard as we finish things up?
Sure. Yeah, absolutely. I actually feel like that's a whole other hour.
I
Uh,
know.
but I think just, I should probably just put all my clients on here and be like, what, tell me. I think feeling heard, feeling understood, feeling like you are moving in the direction towards your goals. I think it's important someone ask you, what are your goals? What are you experiencing? When did it start? Really actually trying to understand. Whereas I feel like in a lot of doctor's office and scenarios, they don't want to know what your goals are if you're walking in with certain, like you said, you have a symptom, here's your issue. I also want lab work explained to me.
Yeah.
The amount of times that we have had, my clients, your clients say to both of us, I've never had someone break down my labs like this.
Yeah.
So taking the time to go through diagnostics with you,
Yeah.
um, we come across many people, women specifically, who are in that 40s to 50s time frame, you know, and we're seeing that they are in perimenopause or menopause. Even though we have solutions to those problems, I always have the conversation with women of, hey, what are your goals?
Hmm.
Because, there are humans out there that to them, it makes sense that, God created aging. They should go through this process and they should, just continue to get old
Yeah.
and to kind of, be in that fall and winter seasons of their life
Yeah.
and not high, healthy, and vibrant to understand that, hey, here's your option. And what are your goals? What are your personal goals? So making sure that you're really aligned, I have things that I would want, but I'm not going to overlay my wishes on top of a human being and what they want their path to look like.
Totally.
So I think it's working with people at, the level of which they are confident and ready
Yeah.
to approach things. We have people frequently that come to us with certain issues and we kind of know that they're more,
Yeah.
but we talk to them about, hey, we can do level one of healing. So
Right.
I think open, honest conversation back and forth is really important.
Yeah.
Um, I think people who are willing to, I want someone who's going to use their brain. I mean, in any field in which that I work in,
Yeah.
I want to go to a chiropractor who's going to think outside the box. Don't just give me the neck, mid back, and low back, adjustment that you just gave the person in front of me.
Right.
I remember going to a functional practice back when I was competing really, really heavy and I was trashing my own endocrine system with not enough food and way too much workout. And I remember having the initial conversation with the woman, and she wanted to do HRT, she wanted to do thyroid, basically here's the box that everyone,
Yeah.
right? And so she asked me nothing about my lifestyle,
Yeah.
even a functional health practice. And Matt, you've looked at my lab work for the last couple of years. I mean, my testosterone is real high and real
Yeah.
healthy
Yeah.
naturally. And so for me to be sitting with these numbers and her, my complaint was tired. I should have had someone be like, girl, you should be tired. Like, what are you doing? You're competing at this high level. You have two options as a human being. You can go take a nap and take
Right.
some time off, or,
Right.
I mean, but she asked no questions about my life. And so I think really having someone who's willing to understand
Yeah.
your individuality as a human being, where you are currently, and then what, you're at point A, where's your point B? What do we want?
Yeah.
And for me, those are the things that I need. I have high expectations because this is what I do. But
Yeah.
I think when it comes to your health, you know, a human being wakes up every day with 100 worries, 100 wishes, 100 problems. A unhealthy and dying human being wakes up every day with one issue, one concern, one problem.
Yep.
And, if you have your health and you are healthy, you are the most blessed human being on the planet.
Yeah.
If you do not, it is your only concern.
Yeah.
And so, it's amazing to me that we skimp and want to negotiate cost of our health when
Right.
really, if we don't have our health, we have nothing else.
Right.
Your kids' soccer practice, your all the bullshit all day long that you have the luxury of being stressed out about, all of that's gone
Yep.
if your health and wellness is terminal.
Yep.
And so, for me, of course, this is what I do for a living. It's what I love. But for me, that there's nothing that comes above my optimal function and my wellness.
Yeah.
And
Yeah.
I think having someone who's willing to think outside the box for you, who's willing to go to bat for you, who's willing to help you endlessly figure it out. I mean, that's where I want to land.
Yeah, someone who's willing to work with you. And to be clear, again, that's not just prescribing what you ask. That's not actually working with you. That's enabling toxic habits. Uh,
Yeah.
Working with you is asking more questions and talking through possible cause and effect. And to be clear, not every functional case requires every test. So I will be the first one to say you shouldn't get hit with $2,000 worth of testing right off the bat.
Sure.
But if there's been enough communication and back and forth where each test is justified, then and the practitioner is putting the ball in your court of we can start here or we could do everything. I think giving options, giving explanations, and kind of letting the patient be their own health advocate without, further detriment is that best approach. And so it's like you and I do, we're trying to meet people where they are, but also be honest with them and also not shoo them out of our office, so to speak, and just give them what they want. We that is not the style that we practice.
Sure,
You
sure.
know?
I think it's having that compassion and understanding, but also, having conviction in, what you know and what you do to, as you and I tell people that we work with together to have that facts over feelings conversation
Yeah,
and, be willing to just be honest with people. So I think for me, those are the things that I look for in someone who, and then also, you mentioned it early on, and we'll say this and we'll wrap up because you and I can be chatty, probably mostly me. But I want to work with someone who values their own health.
yes,
I want to take advice from someone who it's the man in the arena.
yeah,
I come to me with health, value your health enough yourself that you look the part, act the part. Sure, we all have seasons of life.
mm,
Absolutely, we do where, things are healthier than other seasons.
mm,
But in general, I want someone who's willing to lead from the front, who's willing to give me advice because they've also done it themselves. I want
yes,
someone who's going to be able to speak with me through, the things that I'm experiencing and really value their health and have done those things. So that's
totally.
important to me too.
I 100% agree. Yeah, there's got to be there's got to be some experience and empathy there, and through my through my experience of meeting tons of different colleagues and FDMPs over the few years, different practitioners, the best ones and the most passionate ones have very vigorous stories of dysfunction themselves, and that's where that passion and that continued desire for further education comes from, is because they've been through it and they understand.
Absolutely. Yeah, absolutely.
Yeah.
Well, I love this topic. I think
Yeah.
next one should be hormones centered around female health, since we
Yes.
really talked about, kind of unpacking what people experience in the world out there at their MD's
Yeah.
office. So let's schedule it. Let's do it. I appreciate you having me on. I'm grateful. And I guess we can close with
Yeah, we'll close up for today, guys. Just in case you're not already following Lauren, let people know where they can follow you, and in case they want to reach out with anything, how they can contact you.
Sure, absolutely. So Instagram is Lauren M Valentino. Same thing on Facebook. You can also find my business Wholly Fueled on there as well, and website's laurenvalentino.com. So it's all on the interwebs.
Awesome. Well, thank you so much for coming on today, Lauren. I know they're going to love this episode. We'll definitely be planning another one soon, focusing around a little bit of myth busting and the female hormone equation.
Awesome. Thanks for having me on, Matt.
All right, guys, have a great day.